Good evening, everyone. Metabolic and nutritional diseases in sheep and goat. So here I have concentrated only regarding the clinical management and purely regarding the practical aspect, how to diagnose a case clinically and how to treat the case. Pregnancy toxemia, important conditions which are going unnoticed many of the time in our practice. It's seen both in sheep and goat and more common in sheep, and it's also called as lambing sickness or twin lamb disease, pregnancy disease or ovine ketosis. It's mainly due to the low blood sugar. The glucose level in the blood will be very much reduced, and there will be ketonuria, and it occurs during the last few weeks of pregnancy. Exposing factors either it's a cold or inclement weather conditions. Whenever the animal is in negative energy balance, for example, there will be really more number of animals, advanced pregnancy animal in a separate area, and the feeder space will be very much limited. They will be feeding some in a common place, but more segregation. And some of the animals which cannot be assessed for the feed materials. So due to the overcrowding. So day to day, it will be having a negative energy balance, and some of the animals will be having twins or triples or multiple fetus. So the energy availability for each and every fetus, they require about 40 grams of glucose per day. If it is having 2 or 3 fetus, the animal will be having more need of glucose. So if the animal is having reduced feed intake, naturally, the availability of the glucose will be reduced. Whenever the availability of the glucose is reduced, the availability of energy for the fetus will be reduced. And reduced energy availability to the fetus, what will happen? The body system, they will draw energy from the fat. They will mobilize the energy from the adipose tissue. The adipose tissue, the fat is mobilized, and fat is mobilized and replaced as energy purpose. And here, and the energy which is the fat, they cannot cross the placenta. That is the important one. Only the glucose can cross the placenta, and they will cater the need of the fetus. The fat which is degenerated from the adipose tissue, I mean, they are mobilized from the adipose tissue, they cannot cross the placenta, and they do not provide energy for the developing the fetus. Naturally, it will lead to the accumulation of ketone bodies. So ketone body in the level, and it will start exhibiting the signs of pregnancy toxemia. Most of the cases of pregnancy toxemia in sheep, they will exhibit in the twins or triplets. So you can ask the history whether the animal will be lambing twins or triplets in the previous thing. You have to keep it in mind about that, and you can keep your differential diagnosis of pregnancy toxemia. The early signs, the animal will be separated from the flock. Sometimes in the organized form, they will be keeping the pregnant animals as a separate one. So there will be separation from the flock. Those animals will be separated from the flock, and they will be isolated. They will stand alone, and they won't mingle with others, and they will stand still. So it will, even when you make the animal walk, it is reluctant to walk, and sometimes it will raise the head like that. Opisthotonus. It will raise the head. That is opisthotonus. Stand still means when you make the animal walk, or when you approach the animal will be always standing still. When you go near the sheep, the normal sheep, they will run away. So this type of sheep, they will be stand still, and you have to, if it is such a thing, you have to think about whether there is any apparent blindness is there or not, and you have to think about the other conditions like pregnancy toxemia. Later stages, species will be dry and scanty in nature. Muscle tremors will be noticed in some conditions, and after some time, it will start developing convulsions, and the stargazing appearance will be there in some cases, and later will go for recumbency, and depression will be there. And there won't be any elevation in the temperature, pulse rate, and respiration rate. Everything, the vitals will be within the normal rate. Some cases, they will be exhibiting like a chewing and teeth grinding, vigorous licking movements will be there. So in enterotoxemia also, you will be having similar type of clinical signs will be exhibited, chewing and vigorous licking and teeth grinding. Whenever the pregnant animal, a sheep which is having a twins or triplets, if it is not taking feed, anorectic, going for sternal recumbency, sometimes they go for lateral recumbency or stargazing appearance, you think about pregnancy toxemia. Of course, it is due to low blood glucose level. When it is presented in a delayed presentation, when it is coming in the advanced stage, you will be experiencing hyperglycemia. So in the early stage only, you can able to see the low blood glucose level. So many of our friends, they used to discuss, they will ask a doubt, sir, I have seen the blood glucose level, it is normal. Or sometimes they will say it is elevated. Of course, in the delayed presentation or in the advanced pregnancy toxemia case, the blood glucose level will be elevated because of the stress factor and because of the adrenal activation, and because of the stress factor, glucose level will be increased, and ketonuria will be present. So ketone bodies will be present in the urine that we can very well identify with the urinalysis strip, and hyperglycemia in some terminal stages that will be a confusing one. So you need not confuse by seeing the hyperglycemia. Pregnancy toxemia in early stages, it will be having hypoglycemia. Later, it will be having normal glucose level or hyperglycemia. And increased NIFA. NIFA means non-esterified fatty acids. And renal failure at last. That death may be due to the renal failure at last. In the cases, they won't respond to your treatment of pregnancy toxemia. That is due to the end stage because of the renal failure. Okay. Because the ketone body level increases, the bicarbonate level in the blood decreases. That will be bicarbonate deficit will be there, and acidosis occurs. So when the bicarbonate level declines, the animal will go for comatose stage. That is the end stage of pregnancy. There is a clinical condition. So in such a conditions, it won't respond to the treatment. That you have to keep it in mind. Pregnancy toxemia, when it is presented earlier, it will be well and good. When it is presented in the middle stage or in the advanced stage, no treatment will be fruitful for pregnancy toxemia. That we have to keep it in mind. And the blood glucose level increase during the later stages due to the response of the adrenal glands. So mostly we'll be all the times we'll be giving dextrose 20%, and we'll be repeating the cases. I mean the D20 or D25 or D50 repeated treatments, and there is no need of repeated using of the hypertonic dextrose solutions. Just to give glucose solutions, you can give DNS or D20 or D50, whatever may be available. Glucose solutions you can give when there is no response. You need not repeat the glucose injections alone repeatedly. That you keep it in mind. And in some cases, you can give insulin also. If it is needed 20 to 40 units, in alternate days, you can give intramuscular. And electrolyte therapy is most important. Electrolyte fluid therapy is the most important in the management of pregnancy toxemia. And if it is not responding to our medical management, you have to go for the induction of parturition. And oral, after the recovery, for follow-up, you can give oral propylene glycol. It is available in many trade names in the market. You can use 100 ml 2 times a day with the electrolytes will be giving a very beneficial for the recovery. So most of the times the failure occurs when it is presented in the earlier stage. It will respond to the treatment. Again, it will go for the negative energy balance because of the not supplementation of propylene glycol. So if you are supplying orally propylene glycol 100 ml BID or TAD with electrolytes, it will be more beneficial and the response to the treatment will be more effective. And the other supportive treatments, you can give oral calcium preparations, and the potassium chloride preparations will be very much helpful. The animal will be able to recover from the hypokalemia, and the oral calcium increases the survivability of the animals. And electrolyte solutions, you can also even drench with the stomach tube. You can put a small stomach tube. I will show the stomach tube. And you can put a small stomach tube and you can drench the electrolytes also. Or you can put it in a feeding bottle and you can give the electrolyte solutions orally also. Some literature says that a flunixin administration 2.5 milligram per kg body weight increases the survival rate of the dam and the lamb. So in our clinical practice, if you are having a urinalysis strip, it will be very much beneficial for identifying such a type of cases. So whenever the animals are passing urine, just you dip it and you can see they verify the ketone bodies, presence of ketone body. You can very well diagnose the case very easily. So urinalysis strip is very much useful for our clinical practice. You have to use this urinalysis strip and a arrow mark will be given. And according to that arrow mark, you have to keep it accordingly and directly to that related things, whether it's a blood, protein, and glucose, ketone body. All these things are mentioned. Correlate to the color changes, and you can make it as whether it is positive or negative. For example, when the animal is having severe convulsion, pupil dilatation, and it is brought to you with the diarrhea and all, the tentative diagnosis will be enterotoxemia. Suddenly the animal collapse, 2 or 3 animal collapse. So you are doing the postmortem and all, or you are having the urine sample, just you dip it, and most of the time you will be exhibiting glucose in the urine. That you can think about. Yeah, that gives a clue of enterotoxemia. Like that, urinalysis will be very much helpful for our clinical diagnosis. This type of beta hydroxybutyrate strip is also available everywhere. It is available that you can very well use it in large animal practice also for identifying ketosis, and it is same thing can be used for identifying the ketonuria in small ruminants also. So small gadgets, we have to get it in our practice and keep it in our kit so that our diagnosis will be very much advanced, so that it will be very appreciable. Okay, so you can make it a diagnosis and it will be the clear-cut diagnosis and treatment will be fruitful. So you need not to get confused by seeing many clinical. That we have to keep it in mind. In advanced cases, it won't respond to any type of treatment. So that we have to enlighten the farmers or the owner, because in advanced cases, it won't not at all respond to the treatment. And if you are having an ultrasound, it will be very much useful for evaluating the fetus availability, viability, and also we can verify whether 1 or 2 fetus are. Nowadays, ultrasound plays an important role in the pregnancy diagnosis of small ruminants. And during the pregnancy, when animals are segregated in a farm, in the advanced pregnancy, you can diagnose, you can scan all the animals, and you can see which are all the animals having twins or triplets. You can separate them, and you can feed them separately, and you can manage them separately, and you can avoid the pregnancy toxemia. You can prevent the pregnancy toxemia by proper management. So ultrasound evaluation plays an important role. And the induction of parturition by dexamethasone 20 milligram, you can give IM, or dinopras 10 mg IM in case of advanced stages. Even if it is not responding, then you have to go for a cesarean. The pregnancy evaluation, ultrasound plays an important role in the management of these metabolic conditions. Here, the take-home points are: no response to treatment when sheep becomes recurrent. That we have to keep it in mind. Whenever the animal go for lateral recurrency, the pregnancy toxemia with the ketonuria, hyperglycemia, these are the poor prognostic signs. They won't respond to any type of dextrose solution, any treatment. You provide electrolyte fluid therapy, terminate the pregnancy, and see. Okay. And the prevention, provide high energy diet in the last month of pregnancy. So most of the time, there will be fattening will be more occur in the early time of the pregnancy, and during the last trimester, they will reduce the feed. That itself will lead to the negative energy balance. That type of management also some farmers they used to have. In the early stage, they used to give more amount of high energy diet, and in the last month of the pregnancy, they will reduce the feed. Naturally, the animal will go for negative energy balance. So you have to keep it in mind, all these things. There should not be any sudden change in feed. Sudden change in feed will reflect the management aspect in always in a farm, and that will lead to the metabolic disorders. So you should not change the feed, any feed suddenly. Then avoid making the ewes obese in the early pregnancy. That I told already. When you give more high energy diet in the early pregnancy period, the animal becomes very much obese, and the rumen filling will be reduced. In later pregnancy, naturally the intake will be much reduced. So naturally, the animal which is having 2 fetus or triple fetus will go for pregnancy toxemia. These are more chances. Not all animals will go. These are the chances for going. Then avoid abrupt changes in the feed, and avoid stress in the late pregnancy. Any stress will lead to pregnancy toxemia. And provide proper nutrition in the late pregnancy. Segregate the animal, pregnant animal, and the same type of feed till the animal delivers. And proper feeding space should be given. So you should not dump more number of animals in a small space. So when you feed the animal, many number of animals will be getting access to the feed. Few animals, they may not get access to the feed frequently, and within few days they will go for negative energy balance. These are all the causes. And separate thin ewes. You may be seeing thin ewes. I mean, a thin and emaciated animal in a farm. You should not mingle that animal with the other animals. You have to keep the animal separate and reared. And you have to extra caring and extra feeding should be given. Then only you can prevent this type of pregnancy. All these things, differential diagnosis, I'm telling interrelated. Polyencephalomalacia, hypocalcemia, ruminal acidosis, listeriosis. All these things are interrelated. All the metabolic diseases are interrelated. So some few clinical signs will be giving you a clue for narrow down the diagnosis.